So thank you so much, Dr. Bird. It's going to be my position here to allow for the athlete to finish the season, and we'll fix the damage when it is over. Here are my disclosures, none of which are relevant to the content of this talk. So it's been a long evening. Let's take a moment, let's take a breath, let's channel our inner Bob Ross. I just want you guys to imagine a situation here of this 17-year-old athlete. Let's say hypothetically this kid is from Northeast Ohio. Why don't we call him Little Jovi? And what does Little Jovi love? Little Jovi loves not getting grounded. He loves looking smooth in front of the co-eds. He likes getting good grades. He loves soccer. And his ultimate goal is to be able to get a college soccer scholarship. Now let's assess the situation here. So in the state of Ohio, soccer goes from August 1 to the middle of November. So that is about 2.5 months. So it's a 14-week season. Let's just say hypothetically this injury occurs halfway during the year. So we'll just say it would happen during week 7, halfway through September. And the regular season ends in the first week of October. So theoretically, if he injured this during his season, which is his senior year, and he's hoping to get a college scholarship, we at a minimum need to be able to get him at least 3 weeks through that season, and at a maximum 2 months to the state championship. So when counseling the athlete as well as his parents, it's always important to make sure that they understand that there's calculated risks when dealing with these type of injuries, as well as to the return to play. And I always like to channel an analogy from Bob Arciero with being a sports medicine provider, that we really have the luxury of wearing 2 hats, that of being an orthopedic surgeon, as well as the hat of being the team physician. And in terms of the orthopedic surgeon, it's kind of bone broke, me fix, looking out for the long-term health. Meanwhile, in terms of the team physician, we're looking at these injuries. How can we cut this corner? How can we maximize this rehab? How can we get them back faster, while at the same time looking at that long-term health of the athlete and making sure that our goals align so that we can get them back to return playing safely. So now that I've done a good job of subjectively providing part of my argument, let's talk a little bit about the objective measures. And Shane and his group at Rush, they looked at over 1,000 athletes, average age of 32, so a little bit older than this particular athlete right here, with 2.5 years of follow-up. And what they found was that surgical intervention, even after early onset of symptoms, so within that 3 to 6 month window, was still associated with superior postoperative outcomes. So if we're saying hypothetically this kid gets injured, even in the first week of camp, his season's 3 months long, he still falls within this time frame that it is okay to try to let him return to play while not compromising his postoperative outcomes. So, so with that being said, I'd like to provide some tips in terms of helping to get this athlete to the finish line. So let's talk about load management. This is becoming a buzzword in the world of professional basketball, trying to minimize the amount of impact that our athletes going to be putting onto their hips, trying to minimize the amount of practice time that they have to save them for games if we still need to get them through 2 more months of the season. Other things to take into consideration is a rehabilitation program. So working on core strengthening and stabilization, postural retraining, trying to reestablish that dynamic relationship between the pelvic and the hip musculature. In terms of their weightlifting program, trying to modify that. So for this athlete, if we're trying to get him through the state championship, we're going to eliminate deep squats, deep lunges, try to minimize, again, the amount of stress that we're putting on that anterior hip. Focus on low impact conditioning. So if the team's going to be running gassers at the end of practice, perhaps our athlete's going to be on the stationary bike or on the elliptical or running in the pool. And then finally, the consideration of a corticosteroid. I know this kid's under 18. However, with that being said, we could potentially give them a half-dose corticosteroid depending upon how much time is left in their season. See if we can get the inflammation to calm down that will allow for him to be able to return to play. So in conclusion, it is certainly safe to allow for little Jovi to play. It's going to be important to make sure that we watch their symptoms. If he's starting to develop pain with normal daily activities, if he's having pain at nighttime, if he's having pain that's compromising his kinetic chain, then I absolutely agree that he needs to be shut down. If we can certainly modify his activities so that we save him for games and protect him in between matches. Helping to manage it, it's important to make sure that we manage the expectations for the athlete, his parents, and as well as his coaches. And then the rehabilitation can help prepare him for the off-season surgery. Think of it as more prehab as we do with our ACL patients so that he can launch off in terms of his recovery after that he needs that surgery. So, and in terms of how this story ends here, little Jovi was able to play. We gave him the blessing. He returned to play. He got his college scholarship, and that allowed for him to go to medical school so that he could then become a hip specialist himself. Although he's holding the wrong way. So that must have been from the first day of medical school. They soon figured out that it needs to be lengthwise. Anyways, without further ado, thank you so much.